Federal Executive Council approves 8.49 billion Naira for COVID-19 testing equipment procurement.
So we are procuring testing materials right from the sample materials to other kits for diagnostics in our laboratory systems.
Northeast Development Commission earmarked 6 billion Naira as educational endowment fund, over 10,000 expected as beneficiaries.
Federal Road Safety Corps reads Riot Act to container-laden truck drivers.
And a good morning, Nigeria. Today, we return to COVID-19 situation report in states.
Knowing that science and data work hand in hand, recent figures indicate that Nigeria had conducted 42% tests in July than the previous months, such that positivity rate got a decrease in some cases for most places of watch.
All right, and in spite of the varying numbers of COVID-19 declining numbers as announced by the Nigeria Center for Disease Control NCDC in the said period, it is certain we should not think it's uhuru yet, as curbing community transmission is topmost for health watchers.
Yes, indeed, Kieran, to put it in the words of the chair of the Presidential Task Force on COVID-19, Boss Mustafa, he said, Nigeria is yet to reach the peak of the pandemic, and as such, declining cases should not be misinterpreted to mean the end of the situation.
One needs not be told that increased rate of community transmission has spiked for the different states at the different periods from the lockdown to date.
And available information, whether as data and other vital statistics from the weekly PTF briefing, have, however, pointed the direction for all at different levels to take responsibility and to wage further war on the ravaging coronavirus pandemic.
Yeah, palpable fears there. There are many Nigerians expressing worries on the continuous spike to confirmed COVID-19 cases, which heightened by the day in their thousands, and the fatalities coasting to 1,000 as well. Today, community transmission is said to be on the increase in about 536 local government areas, having reported at least one case. So, it is pertinent to understand what the COVID-19 advocacy response, capacity and capabilities are for the federal government and the subnationals in addressing the pandemic.
Okay, now with Mr. President approving the retention of the current phase of the national response for another 4 weeks, tweaking guidelines here and there, it is expedient as well to understand how the states will be committing to boosting their response to the fight against COVID-19. These and more issues will form the thrust of our conversation today as we examine situation reports from states. I am Juma Yusuf. Welcome you to the program.
And I'm Kieran Umar. Many thanks for joining us this morning. We are reaching you live as usual on the network service of the NTA, and we will likewise bring you our usual complimentary segments that will include the newspaper review, business news, and others. For now, let's join Degun Lawyer to bring us the morning news. Dennis, it's good to see you.
You too, Kieran. Good morning, and good morning, Jume. Good morning, Nigeria. Here is the morning news. Far-reaching measures have been taken by the federal government towards repositioning the nation's mining sector in furtherance of efforts at diversifying the economy for sustainable national development. Consequently, the National Security Advisor has been directed to coordinate targeted operations against illegal mining activities nationwide, while states and local governments have been warned to desist from illegal mining taxation. Information and Culture Minister Lai Mohammed made this known while briefing newsmen on resolutions of the Federal Executive Council meeting.
Advisor to facilitate the erection of central magazines. These are special, storage facilities across the geopolitical zones of the country for mining purposes. Storage of explosive in the military barracks in some parts of the country is grossly unsafe and the establishment of a control and command center for remote monitoring of such explosives.
And the Federal Executive Council has approved 8.49 billion naira for the procurement of necessary equipment for the testing of coronavirus, which is aimed at controlling and containing community spread of the global pandemic in the country. Minister of Health Osage Ihaniere disclosed this while briefing newsmen after the meeting of the council presided over by President Muhammadu Buhari. The council also approved a national gender action plan.
We are procuring testing materials right from sample materials to other kits for diagnostics in our laboratory systems to be able to respond properly to the community transmission phase. We have already made plans to have at least one sample collection site in every local government, minimum of 774, and these resources will be necessary to go around the 774 local government areas to ensure that persons in rural areas or small towns are not excluded.
Meanwhile, the Nigeria Center for Disease Control has confirmed 453 new cases of COVID-19 in Nigeria. The new cases recorded from 16 states indicates that Lagos has the highest number of new infections with 113, followed by the FCT with 72. Next is Plateau with 59 new cases. Others are Enugu recording 55, Kaduna 38, Ondo 32, Osun 26, while Ebonyi has 20 cases and Ogun 9. Delta recorded 8 new cases, Borno 7, Akwa Ibom 6. Bauchi, Kano and Ekiti have 1 new case each. Nigeria now has 47,743 confirmed cases, out of which 33,943 have been successfully treated and discharged, as the death toll now stands at 956. The Revenue Mobilization Allocation and Fiscal Commission has called for more development of the gas infrastructure with a view to harnessing more revenue from the sector to the Federation account. The chairman of the council, Elias Mbam, who gave this indication via a recent release in Abuja, noted the potential of gas to revenue generation is enormous and needs to be properly exploited. According to Mbam, the continuous flaring of gas in the country is not in the best interest of the nation, noting that there are health hazards posed to oil-producing communities. He says flared gas in Nigeria could be converted and channeled to the economy, where more than 2 million people could be employed in power generation. He believes that the sector could be a safe haven for the country, while projecting that Nigeria could generate more than $1 billion annually. The Northeast Development Commission has earmarked a 6 billion Naira education endowment fund where over 10,000 people across the Northeast are expected to benefit. Managing Director, Special Intervention on Education of the Commission, Mohammed Goni Alkali, disclosed this when officials of the Northeast Civil Societies Organization called on him in his office in Maiduguri.
The Commission, we have agreed that any project is done in local government or done by local people there.
The Air Task Force of Operation Lafia Dole has destroyed a Boko Haram terrorist logistics storage facility and neutralized many of their fighters at Yamud along the Gulumba-Ghana-Kumshe axis of Borno State. Defense Media Operations says the operation was executed on the 11th of August in response to intelligence reports indicating that the settlement was one of the locations where the terrorists saw their logistics assemble and launch attacks. Detailed surveillance reports also established the presence of a significant number of terrorists within the settlement. Accordingly, the Air Task Force detailed its fighter jets to attack the location, scoring accurate hits leading to the destruction of designated target structures, as well as the neutralization of some of their terrorists. We say we do was a popular call to action slang in the Federal Road Safety Corps a few years ago. I guess the spirit of we say we do is still there, as the Corps arrested 129 drivers of unlatched trucks and prosecuted 40 of them within 3 days of the commencement of Operation Scorpion 2. FRIC Corps Marshal Boboye Oyeyemi at a media briefing in Abuja says it is now time to bark and bite.
We must draw a line in respect of these falling down containers, broken down articulated vehicles, worn-out tires, frequent lawlessness on the highway. I think we need to be responsive to what the Nigerians really want, to sanity on our roads. If the minimum safety standard is not complied with, I think it behoves on us to check the owner of the cargoes to be punished along the line.
Truck drivers, beware. And that is the conclusion of the news highlights. Good morning, Nigeria. On COVID-19 situation reports in states. We'll continue with Jume and Kieran after this break. I'm Dennis at Degunloye. Good morning.
Let's now join Comfort Amadu for more stories in the financial sector as the economy of the U.S. slumps.
Trading activities on the floor of the Nigerian Stock Exchange maintained a positive posture as investors gained 134.47 billion naira and the all-share index firming up by 1.04% to close at 25,141.48 basis points. Its year-to-date returns currently stands at 6.34%. Market breadth closed positive. The CEPLA led 18 gainers, as against 10 losers, topped by Champion to boost market turnover, with the U.S. economy shrinking by 20.4% in the second quarter of the year.
Asian stock markets are also facing the same challenge, whether it's the Shanghai Index or the Nikkei 225 in Japan. The same story.
Oil prices moved high on Wednesday as inventories of crude fell more than analysts had expected, boosting hopes that fuel demand can overcome the coronavirus pandemic. Brent crude was up 15% at $44.65 a barrel, while West Texas Intermediate oil was up 9% at $41.70 a barrel, having dropped by 0.8% in the previous session. With Business News, Comfort Amadu.
Well, thank you, Comfort, for that business package. And up ahead on Good Morning Nigeria is Newspaper Review.
And our newspaper reviewer, Bayo Chobi, is on the studio. Good morning, Bayo.
Good morning, Jumwe.
See you.
Good morning, Keria.
Yeah,
good morning, Nigeria.
See you again today.
Thank
You're
you.
welcome.
Thank you.
Okay, let's start with the Punch newspaper. Above the nameplate of the Punch newspaper, experts fear downturn in Nigeria as UK enters recession. That's on page 24. Allow responsible Nigerians to carry AK-47 others. That's according to Otom. He tells the federal government, Otom, of course, is the governor of Benue State. Army proves alleged soldiers' involvement in illegal fishing and trading. It's on page 8. Now, we will impeach Obaseki if he flouts laws. Edo State Assembly faction boasts. That's on page 2. The lead story on the Punch newspaper this morning, APC interim panel battles against time. Party to shift convention. It has 3 riders to that. Committee to meet next week, yet to begin reconciliation. Defunct NWC members grumble over lack of consultation. PGF DG Rights Committee seeks another NEC meeting. And of course, the picture, the photograph, the Punch newspaper actually showing arrival of 94 out of 150 stranded or trafficked Nigerian girls in Lebanon at the Murtala Mohammed International Airport. You can see them in a jubilation mood after returning to Nigeria. Now, Abuja Isolation Center remains short over lack of bed spaces. It's on page 8. Ex-U.S. envoy to Nigeria, Carrington, dies at 90. It's on page 11. Now, send old generation out of power Obasanjo tells you. That's on page 14. Police arraigned driver, vehicle owner in Kaduna on page 11. And then Kano Sharia Court orders 60-year-old rapist stoned to death. That's on page 7. Bauchi uncovers 369 dead pensioners, workers on payroll. That's on page 7.
And next on the review is the Daily Trust newspaper, and just below the masthead, just like Kieran read in that paper, squeeze older generation out of power. That's coming from former President Obasanjo. He's telling the youth of Nigeria. You find that story on page 8. Magu challenges Salami's panel, alleges rights violation. That story you find on page 32. Sanusi proceeds to Oxford University as visiting scholar. That's the former emir of Kano. You find that story on page 7. The bold headlines from the Daily Trust newspaper: COVID-19 hits 586 local government area. Quite an alarming figure there with rider. Experts blame citizens' non-compliance to guidelines. FEC approves 8.49 billion naira for test kits. Health workers strike over welfare. And the picture story you see there, members of the Petroleum and National Gas Senior Staff Association Pengerson protest over non-payment of their 3-month salary in Abuja yesterday. And at the bottom plate of the Daily Trust newspaper, DSS grills Melafia over Boko Haram allegation. That story you find on page 6. Kano, rape. Kano court sentences 60-year-old man to death by stoning. Well, that's all we have on from the Daily Trust newspaper bio.
Thank you, Jumai. Well, let's start with the story about COVID-19. It is very alarming that community transmission is now involving 586 of our 774 local government areas. Nice. That level of transmission should be very worrying. It means that it has almost permeated all the 774 local government areas in the country. As at yesterday, the data shows that we had 553 new cases in 16 states. Death toll has now, yesterday we had about, I think 6 it was. We now have 956 Nigerians that have died. So far, our data shows that we have had 47,743 of our compatriots that have fallen victim of COVID-19. And yesterday, in the determination to ensure that the war against COVID-19 is waged, the Federal Executive Council approved 8.49 billion for procurement of various testing materials for NCDC. You recall that when COVID-19 arrived in February, we had only about 3 test centers.
Yes.
As at the last count, we have got to about 58, and the Presidential Task Force is targeting having testing centers, at least 1 per local government area, 774. And that means that everywhere will be empowered, and therefore testing can be taken closely to the rural communities. Meanwhile, the story that Kirian read earlier on, 94 Nigerian girls stranded in Lebanon have arrived home. They are now to be in self-isolation for 14 days. It may be recalled that there was an early alarm about 150 of them that were stranded in Lebanon. Nigeria Diaspora Commission, the embassy here, Lebanon Embassy in Nigeria, and its counterpart in Lebanon, all work together to ensure that they have been put in one same place. Now they are to be evacuated in batches. The first batch arrived on August 12th. The second batch is due to arrive on August 14th. There has been some conflicting report coming from University of Lagos. The Governing Council of the University of Lagos announced a new Vice-Chancellor in Professor Omololu Shoyombo. He's now the acting Vice-Chancellor. However, the Vice-Chancellor that was removed, Professor Ogudipe, says that his purported removal violates the UNILAG Act of 2003, and therefore he has directed that the people, staff at the university should ignore it. But the registrar, who is also the secretary to the council, says that he is secretary to the council and he's confirming that Professor Ogundipe has been removed, and he alleges that the Vice Chancellor was removed based on investigation of serious acts of wrongdoing, misconduct, and financial recklessness and abuse of office. Meanwhile, the university community seems to be confused. The Senate lecturers and non-academic staff said they do not understand the position because the Vice Chancellor is said to have been removed. There's an acting VC, but the Vice Chancellor that has been removed said they should ignore it. He is still in charge.
But is he still reporting to his office?
Incidentally, he's not even in Lagos. I think he issued a press statement in Abuja
But who has
denying that
power
refuting his removal.
to remove Vice Chancellor?
The Governing Council.
The Governing Council of the
And
university?
the registrar says that he is the secretary of the Governing Council, and from the minutes of the meeting, the Vice Chancellor stands removed, and an acting VC has been appointed.
In fact,
Can that be done without the knowledge of the government?
The president is the visitor of every federal university, but the day-to-day affairs of the university is determined by the Governing Council.
Okay.
All right. The issue of COVID-19 permeating the local government area is one aspect of what you analyze that is quite touchy, because if that happens, it does mean that this is just the beginning of the spread of this virus in Nigeria. We're considering the council areas that we're talking about. Some are in remote areas, and then that's where we have aged Nigerians, who may have underlying illnesses and what have you. And of course, for Nigeria to have sufficient test kits that could go around the 774 council areas in Nigeria is another challenge, right? So I don't know if the statistics is right. Then it does mean that we have to really get prepared for a serious fight against COVID-19, because community transmission is the highest level of transmission you can get. And part of the reason why we're getting this is because in local government areas, people are still carrying out their social activities, festivities, weddings, burial ceremonies, and what have you, without recourse to the protocol, COVID-19 protocol. So it happens even in my area, right, and the localities, and one wonders why the local government administration will allow such activities to be going on, even masquerading and all manner of festivities are still going on in the hinterland.
You really need attitudinal change towards COVID-19.
Yes, you recall that the Presidential Task Force has said that there's need for state government and local government to ensure that responsibility is assumed down to the grassroots level. The danger here is that there had been the assumption that it is a big man disease. It is the traveler's disease. But the disease is now here with us. The community transmission has permeated from the cities now to the rural areas, especially that we now have 586 local government areas. That is the danger signal, and the earlier we heeded it, the better for us.
The virus doesn't move. We move the virus.
We move the virus, yes.
So now this issue of Kano Sharia court ordering 6-year-old rapists to be stoned to death.
Sharia court is a secular court. Yeah. Sharia law obtains in some northern states, 12 northern states of the country. And earlier on, there was somebody who was found guilty of blasphemy. Yes. And in the context of Sharia law, the punishment there is death. And this one too, the punishment for rape, according to the Sharia prescription, is stoning to death. However, there will be hue and cry because there is a general atmosphere about revulsion, about capital punishment for whatever punishment, for whatever offense now. Ironically, just some couple of weeks ago, Nigerians were reacting to increase in the rate of rape, and many were even calling for death penalties. It's because of the grievousness of the rape that is becoming so rampant. But the idea of capital punishment for any offense whatsoever is being frowned out the world over, and therefore you will see a lot of reactions about this. But according to the Sharia, those pronouncements are within the context of that law.
Okay, let's now quickly go to the editorial, and it's coming from the Punch newspaper, and it's talking about beyond World Bank $500 million for Nigerian girl child education. I'm just going to read a little out of it. A fresh attention has been drawn to the urgent need to redress the despairing state of girl child education and, by extension, the miserable living condition in northern Nigeria. This followed the launch by the World Bank of a credit facility to improve secondary education opportunities and empowerment for adolescent girls in targeted areas. The beneficiary states are Kano, Kebbi, Kaduna, Katsina, Borno, and Plateau. Only Ekiti State in the southwest is outside the northern region. Yes, say you educate a woman, you educate a nation.
Yes, indeed. The fund is $500 million, and it's meant for girl child empowerment as in regards of education for 6 states in northern state and 1 in southwest. And going by the data, the figures are very alarming. Out of about 1.5 to 13.2 million children out of school, a higher percentage of them are the girl child. Yeah. And like you said, if you educate a child, you educate a nation. A mother is a better mother when she is educated, because she will impact on her children and her family.
And the society at large.
And therefore, what the editorial is happening on is that we should make governments, particularly in the concerned states and all over Nigeria, should ensure that there is a deliberate policy to encourage the girl child education. And they recommend 3-pronged approach, that they should prohibit withdrawal of girl child from school, they should encourage their enrollment, and especially instances where the girl child education is interrupted for marriage should be stemmed. That will go a long way to empowering the girl child. And the editorial is recommending that we should emulate Egypt. Egypt has a vision 2030, and they intend to reach a zero ignorance or illiteracy level for all its citizens, and we should adopt such a policy for the girl child. And also we should not forget the adolescent boys. You recall that in the era when they started nomadic education, there was a deliberate attempt to look at certain parts of the country where young boys, rather than go to school, were inclined towards apprenticeship only. And eventually they become very big businessmen, but they were illiterate.
And so need to employ educated people.
Thank you very much. So there is a need to also not to forget the adolescent boys, looking for the adolescent girls.
All right, Bayo, we would like to thank you for the analysis. Hope to see you again tomorrow.
Thank you.
When we bring a fresh edition of Good Morning Nigeria. All right, now we are taking a short break. When we return, we will, of course, delve into a major issue for today, which is...
Nobody expected that this outbreak would be like this. So nobody knows how the next one is going to be. It might turn out to be worse than this. And all those things that lead to the emergence of these new viruses are there. We're still doing them. We are destroying the forests. We are, intruding into the ecosystem of animals. We're increasing the interface, between humans and animals that leads to this interspecies jump. This virus came from animals, like Ebola came from animals, like HIV came from animals. The vast majority of the new diseases that we're having are coming from animals. So most of these things that, have led to the emergence of new strains are still there. So we have to pay a lot of attention to those things.
One was labeled in accordance with the patient's data, and the other one as if a patient was coming from another state. It will interest you to know that the woman from Kogi State tested positive, while the other one was negative.
But the same test from the
same woman. Then the 4th and 5th patients, for weeks now, I have personally made calls to directors in Gadwa Laboratory, one of the NCDC controlled laboratory. They have refused to give us, other than names of those patients, the identity of these patients.
All right.
On condition that the patients declined.
Because
right from the time we started having Lassa fever in 2005 in Ebonyi State, we didn't have much intervention. We didn't have much support from the national until he came on board. And with that collaboration, Ebonyi State has done very well. And also the PTF, who has been there for Nigerians in this fight. So I want to say that we urge all Nigerians not to relent, because when you check the trends in other places, you see that the awareness is increasing. But it's not like that in Nigeria.
We have improved our call centers so much. The challenge right now is that 30% of our calls are hoax calls. People just calling to block the line for all sorts of reasons. But our lines are...
Okay, well, thank you very much. We're out of time. Dr. Yekwazo, always a delight having you on Good Morning Nigeria, Director General, NCDC, joining us via Skype from Abuja here. Also with us on this conversation, Daniel Umezurike.
All right, well, that's excerpt from the previous edition of this program that, of course, dealt with the issue of coronavirus in Nigeria. For today's edition, let's welcome to the program, and of course in our studio here in Abuja, Executive Governor of Plateau State, Simon Lalong. Your Excellency, you're welcome to the program. It's
Thank you very much, Kieran.
Good to have you with us here on the show.
Thank you very much, Kieran.
All right, and also in our Abuja studio is Dr. Mohammed Kau, the Acting Secretary, FCT Health and Human Services Secretariat. You're welcome to the program.
Thank you, Kieran.
Yeah.
So also joining us from our Ibadan studio is the Oyo State Commissioner for Health, Dr. Bashir Bello. You're welcome to Good Morning Nigeria. And joining the conversation too is consultant clinical microbiologist, Lagos University Teaching Hospital and senior lecturer, University of Lagos, Dr. Rita Oladele. She's joining us via Skype from Lagos. It's a pleasure to have you on the program.
Thank you very much.
All right, ladies and gentlemen, it's a delight to have you this morning on Good Morning Nigeria, and we are focusing on a very, very important issue, of course, that has to do with our health, which is COVID-19. And I would like us to begin by, of course, taking on the governor of Plateau State for a while. In recent weeks now, there's been a spike in COVID-19 records in Plateau State.
Yes.
And could you just give us an idea of what might be the reason for this, and of course what you have been doing to stem the tide?
Well, thank you very much. For us in Plateau, we will not be surprised, because when you get a spike like this, it also depends on the number of tests that you are doing in your state. You recall that I'm not only talking about Plateau, I was also talking about the northern states. At a point, I was shouting every time for federal government and the NCDC to improve on testing capacity for the north, especially when we had a very serious case in Kano. And most of them were going about all the parts of the north. Our case in Plateau came from Kano. And we took a proactive action. And immediately, all we needed was enough testing capacity. And in Plateau, the first, I think, apart from FCT, the first thing I did was to make a case for the MVRI laboratory. And it's one of the best in the country and even in Africa. But it was left like that. And so immediately attention was given to it. And we had the first testing area around that side, which served our interest. The north, part of the north, the Bauchi, Gombe, Adamawa, all coming there to do testing. Now, in respect to the capacity, or in respect to the numbers that you are seeing today, in Plateau State, so far, we've had a total of over 20,000 testing. And out of it, we have outstanding cases of 3,000 plus awaiting results. The problem we're having now is that instead of immediate results, we don't get the immediate results. Sometimes they release 1,000 plus. And out of 1,000 plus, you expect that you will get up to 100 cases. 100 cases. So apart from the NVRI, we also have two additional now. We have the Plateau State laboratory testing. We have Jos University Teaching Hospital testing. And for that, as far as I'm concerned, I felt it's not enough, because we at the Northern Governors Forum made a case, and now we've procured mobile testing vehicles, which we're expecting very soon. I'm sure of this week or next week we'll have them so that this testing capacity will also improve. In each of the states, I think the maximum we got was 3 per state. Some states ordered for 2, but all of them, about 25 of them are coming. And when they come, we'll get into, because we're at the stage of community transmission. And when you get to community transmission, you expect a lot of cases coming out. But for me, in Plateau State, why I say I'm very comfortable, I'm not worried about the number, is because I look at the number of deaths. Now, when you look at the high number and look at the number of deaths, you also know that it is well controlled. The better you get the statistics, you get the data for your people who are sick, is more important for you, so that you now have a plan to address the issues. So we have the number. It is also part of our testing capacity, 1,000. Out of every 1,000, you have also expect that you have a percentage of up to 20 or 30 people. Yesterday, I just saw 59. Now the 59 is out of what? Because what we do in the state, the minimum test number that we have is 500. 500 in a day. So to me, we are even second to Lagos in terms of management now. I should think that Plateau is second to Lagos. So we're trying to do that. And within the last month and this month, what I did was, when few of my commissioners were tested, my chief of staff tested positive, and 2 commissioners. I said, all the commissioners. I went back for a test myself with all my family, and all of us were negative again. But what I did, I now called the head of service. I said, look, go and test all the civil servants. So what we have done now is compulsory, all civil servants. Even before federal did it, we had done it in Plateau. We're already 2 weeks before I saw it at the federal. It's now compulsory in Plateau State for civil servants to go for tests. We started from departments to departments, and each of the departments will get, sometimes we get a few number. So, and what we did to address, because if we were going to put them in isolation centers, our isolation centers will not be enough. So we now went to taking the other protocol from NCDC, that is the home treatment. So a lot of them are at the home treatment, are doing the home treatment, and it's very successful. So you don't have many people, number of fatalities, but you have control people, and you see civil servants now rushing to come in a queue that they want to be tested. And through that, we now use the community, we use community leaders, we use traditional rulers to go back to the villages, to the nooks and corners of the villages, to also transmit the information, sensitize people, because I had also argued for involvement of the National Orientation Agency. I said that is supposed to be their work at a national level. Let them come to complement. We will complement them through also the states, and so that they will carry this to the rural areas. And I'm expecting as soon as we get our mobile testing vehicles, you will see what we will do in the north, because almost every nooks and corner we are moving the vehicles and using traditional rulers, using community leaders, and carrying out with the national orientation and some of the information departments in the states to ensure that the common man understands this. Because as we are releasing and easing down the lockdown now, the people feel as if the COVID is over, COVID-19 is over. That's the impression, that COVID-19 is over, so people can go back. But the purpose of our easing the lockdown, I'm a member of the Ease Down Committee, the 5 governors that advise the president, and together with PTF every week to advise the PTF. Yes, we did that. We gave advice for Ease Down, because we know that COVID-19 is going to be with us for a while.
Yes.
Measles came here. It was killing people. But at the time, when people followed the protocol, they will tell you go to hospital, and they say, no, go isolate yourself at home. Don't allow yourself to mingle with your family. And today, we are not talking of measles. We are not talking of measles. But my thinking is that we should not joke with COVID-19.
Yes.
Because we should carry it the way we move polio. Today, I'm very happy. I congratulate Mr. President and everybody for polio-free Nigeria, because we took a step. It wasn't easy for traditional rulers. Some traditional rulers, I must know, especially, I'm talking about the North now, because as chairman of Northern Governors Forum, it wasn't easy. But at the end of the day, some of them sacrificed their positions, they sacrificed their lives, And today we are polio free. Now let's take it the way we took polio. Let us not think that COVID-19 is going, because sometimes it will go, sometimes it will move. And up to today, we've not found a vaccine for it. We don't know what will happen. They say it is cold. I'm worried because I live in the coldest part of Nigeria, in Plateau State. People say perhaps they are seeing number because of the cold in Jos, because Jos now is very cold. It's quite cold. So I am also planning on that. I say if it is cold, we'll find a way of addressing it, because I don't want my coal. My coal is supposed to be sold for tourism. It's sold out for tourism, attract tourists.
Okay, Governor Lalo, if I might come in here, you've been talking about the successes you've had in Plateau State, and you sort of started, covering the curve before other states began. Yes. And we're looking at 586 local government areas in Nigeria. That's more than 70% of the local governments in Nigeria. And in Jos, we have 59 new cases. So what are you doing as leader of the Northern Governors Forum as part of synergy between all these other governors to curb the community transmission?
We did that. I mentioned part of what we did. Yes. It wasn't only dealing with the COVID-19.
I'm talking of the challenges now you have.
The challenges we have is because, we had several meetings at the Northern Governors Forum. And because we were really worried, not only talking about those who are taking proactive actions, but also emphasizing those who are not serious. I'm sorry to say that I had to engage my friend, the governor of Kogi, several times. And I told him, you are part of the North. I don't want, because when we had issue of Kano, I spoke very well with the governor of Kano, and we knew the attention we did, even having a 20 minutes conversation with the president. And the president gave me opportunity. We had a conversation with him on behalf of the Northern governors, and I raised the issue. And I was very happy that the next week, the president moved the team to Kano. And also on Kogi, we did that because it's part of northern Nigeria. And I told him, whether you like it or not, we have to move people to that place. We have to move people to that place, because even if you don't believe that there's no COVID in Kogi, there is transmission. They will move out from Kogi to other states. And we don't want that after addressing the whole North. And then tomorrow we have a spike in Kogi. He has agreed, and I think he's now complying.
All right, Your Excellency, we have to pause you there. We'll really come back to you.
Thank you.
As we make progress in this particular conversation. But right now, we have a special report, of course, that will give us the situation in Oyo State. And after that, we'll be introducing guests from that part of the country. That's Dr. Bashir Bello. But for now, let's take that special report.
Currently, Oyo State is number 3 in cases of COVID-19 in Nigeria, with close to 3,000 cases, while Abuja is listed number 2 with more than 4,500 cases recorded in Lagos State with the lead figure. In lieu of this, Oyo State government has stepped up awareness and enforcement of COVID-19 preventive measures. Also, the state government is not resting on its oars at ensuring that residents imbibe the culture of using face masks in public places, washing of hands with soap under running water, and maintaining social distancing.
As we speak, we have a positivity rate of less than 20%, and we hope, from what we are seeing now, within the last 2 weeks, the numbers are actually reducing across the state.
Residents of Ibadan, however, advocate stricter enforcement of these guidelines.
In Oyo State, when you go out in town, you see the way and manner people behave. Either in Mikra or Kada or everything you see. We talk so much on how they should pick passengers, how many people should be in a vehicle or an Okada, but people will not do so.
Frontline workers, including journalists, are of the opinion that to flatten the curve of modalities, there must be provision of personal protective equipment to stop the spread of the virus. In Ibadan, Rofia Animation Badmos, NTA News.
Thank you indeed for that report. And at this point, let's introduce our guest in our Ibadan studio, and that's the Oyo State Commissioner for Health, Dr. Bashir Bello. Dr. Bello, good morning and welcome to the program.
Good morning, all. Good morning, Nigeria.
Thank you. We've just listened to the report from Ibadan there, which specifically noted that people are not adhering to the COVID-19 protocol in Ibadan. Of course, the two respondents who actually spoke to our reporter made that statement. And again, we would like to find out from you what the entire situation is like with respect to COVID-19 infection, and of course how the state government is working towards curbing the spread of the virus.
Very much. Our state government actually had been making a lot of efforts, positive efforts, we shall say, in curbing the spread of the virus. As you know, health is one of the four major pillars of this present administration. But that being said, the challenge posed by COVID-19 pandemics is actually taken as a means for us to be able to maybe improve on our health system and make some things that are quite lasting. And that is why the government, immediately on the onset, started the conversion of some of our major hospitals into treatment centers, which remain permanent not only for COVID-19 pandemic, but also for other related infectious diseases that might occur in future, so that we'll be able to, in the same vein, contain the pre-existing Ebola and Lassa fever viruses. Viral diseases, as we know, particularly this one, is something that, as I've been earlier said, that we are going to live up with. The only thing is for us to find a means to either flatten the curve or rather lower it in its entirety. Meanwhile, in Oyo State, the main factor we're having, and which the Chief Press Secretary to the state, who is also the risk communication coordinator, is on the community non-compliance. You see, no matter how you go about it, government is doing all it could, within our best capacity to inform the public. But you see, the tendency is for an individual, although people are now believing that it is no longer an elite disease, but all the same, they are considering the economic aspect. For example, if we talk of safe distancing in motor cars, in taxis, and particularly Okada people, they hardly will believe it is something real. But with the upset of our communications, because we know our Honorable Commissioner for Information, who is also a member of the COVID-19 task force, had gone to all the interlands. He has also involved all the Obas and natural rulers to be able to speak to our people in the very language they understand, so that, with interjection of proverbs, so that the thing will be conveyed to them. Some of them have been yielding, some have been leaving it, but I think the effort is, what are the people themselves doing to save their own lives? They need to complement the efforts of the government. Meanwhile, in Oyo State, particularly in our isolation centers, we thank God we've not had any case of death reported in any of the 4 isolation centers that are currently operational. Other centers are being prepared. Yesterday, His Excellency was on a visit to see the level of preparation and construction of, or the conversion of the new center at the Lautech Teaching Hospital Complex. He has also visited some other centers to know the level of preparedness, and we believe that Professor Alonge, being the coordinator of all our isolation centers, is getting the Shaki Isolation Center and Treatment Center ready and will be operational in a few weeks, given all the mandate. Readily now in Oyo State, we have the Olodo, that is the Infectious Disease Treatment and Research Center at Olodo functional. The Agbami Center, both at Ibadan, are also functional. We have the Awe Isolation Center too, which is readily functional. And nearing completion are the Igbora centers, Shake Isolation Center, as well as the Lautech Hospital Teaching Center. Meanwhile, in Oyo State, we are experiencing a sort of control. As I've mentioned earlier, we thank God there have been no form of deaths in any of our isolation centers. This is due to the managerial skills, the treatment skills, because what we do is that after a comprehensive assessment of our patients, the inpatients, we go on proper management of each case. And then freely, the government provides a very standard, robust nutritional level. That is foods given free of charge, thrice daily, you know, with all related medication, depending on the intensity of each case. Because the center even has a high dependency center as well as an intensive care unit. And all these inpatients have regular exercise. So, in fact, you know, talking of our confirmed cases, that is of about 2 days ago, I'm not in control of the statistics up to yesterday night because we are away with His Excellency outside Ibadan. But we had a total of about 2,825 confirmed cases, while active cases are about 1,373, with a total of about 1,420 cases recovered, fully recovered. We have roughly about 27 new cases per day, and I've said earlier the positivity rate that is being recorded now is somewhat below 20%. And this is due to the fact that we are actually spreading to community testing levels so that we know the impact, the epidemicity of the disease. And I think by and large, we have recorded up till recently about 31 deaths. That is the latest figure. But none of these deaths had actually been in the isolation centers. So, so far so good. That is a brief summary of the situation in Oyo State today. We thank God for the cooperation of our COVID-19 task force headed by His Excellency, the Executive Governor of Oyo State. One thing we must credit him for is that for whatever is needed, you know, being an emergency situation, money is being immediately released, and these are being directed to the proper places to be able to curb the disease. Is always along with the team because Oyo State COVID-19 task force stands on a basic tripod. That is the scientific facts, that is professional technical group as it is, the data, that is the evidence-based data that is on ground as far as Oyo State is concerned. Then we juxtapose this with logic, that is the third factor, that is the third leg of the tripod. So all these factors are the things we combine together that has made the management scale a little bit worth credit.
Dr. Bello, if I might comment there, you know, you've been reeling out all these numbers of positive cases, you know, some of them discharged. I cannot understand the concept that there has been no death recorded in Oyo State.
That is in the isolation centers. We have 31 deaths recorded totally in Oyo State, you know, in different other centers that are related. And most of these, as I've told you, are due to comorbidities, you know, pre-existing diseases that COVID-19 just came, you know, to, you know, rather camp on a rather low immunity defense system. So those are in some other centers, you know, but not those that we are taking in in our isolation centers in Oyo State.
We'll come back to you in the course of the program. Let's now join Dr. Muhammad Kawu, Acting Secretary, FCT Health and Human Services Secretariat. Abuja is always at the top of the list. What's going on with all the precaution measures taken?
Not always. Lagos sometimes plateau. We've been competing with these three states, but I think I will just agree with the governor.
Okay.
Most importantly is not the number of people it's not the number of people that you get positive that's important.
Yeah.
It's how many people did you test. You want to know the burden of the disease instead of lying down and say you have 3 while the disease is spreading in the society. So I think it's the increased testing that is usually giving us this
numbers.
These numbers.
Go ahead.
Yeah. So we are comfortable. We are happy that we are testing a lot, and so we are getting a lot of those people that are infected. Whether you like it or not, they are there. They are infected. They are in the community. So what is important is for you to find them. So if you test, you find them. If you don't test, you have lower number, and the disease continues to spread. So number is not the issue.
Okay, as the community transmission continues to go higher every time, and what is the level of compliance in Abuja? At times you find, you just think nobody is really caring whether COVID-19 can kill.
It's true and it's sad. Of all the information going on, the social mobilization and involving the traditional, the community leaders, people still don't believe or are careless. And I like what the Oyo State Commissioner said. Whatever government does, if the people don't take personal responsibility, we're going to have a problem. And I don't know why people still believe it's an elitist disease. I can tell you, when you go to the suburb, you find that as if nothing is happening. Despite the radio jingles, there is no station that does not carry this message continuously. If you open any TV station, radio station, that's what you hear. But people still don't believe these things. So I think we need to do more in terms of enlightening people, and probably we'll continue to do what we've been doing. I mean, we go around the treatment centers and take pictures of people that have been on oxygen, people that are on admission. Because sometimes they believe that if you say people are having COVID, why are we not seeing them like what we see abroad? That's what happens. So we need to, I think His Excellency needs to work with his governor colleagues. We should take pictures in all the isolation centers, especially those on oxygen, and be showing people that, look, what is happening abroad is also happening in this country. We are lucky, yes, the death rate is much, much lower. But the people that are infected, I told you I was infected, and I was on admission. While I was on admission, we had 6 patients that were oxygen dependent for about 7-8 days. And so it's real,
Yeah. Well, it's really unfortunate that many Nigerians are living in denial, even with all the messages being read out on radio and television about this. And I have personally moved around Abuja and discovered that even the simple face mask that we should wear, people don't wear that, even in marketplaces. That is bad. And from what Dr. Kawu has told us, the reality of this is just there. It's not a question of whether you like it or not. That is what is happening. COVID-19 is real, and it is better that you take all the precautionary measures to ensure that you don't get it. All right, now let's go to Lagos, actually, where we have consultant microbiologist. Madam, let's bring you into this conversation. Now, since the advent of COVID-19, what has become so difficult, is to understand the biological behavior of this virus. on weekly basis or so, even on daily basis, we tend to discover one new thing concerning the virus, either the treatment of the virus or the way the virus mutates and its reaction and the extent it can go to attack all parts of the body. Now, as a microbiologist, what new are you learning about this virus, that could lead to a better understanding of how the virus, behaves and attacks the body system?
So I guess I should start by saying thank you for having me on your program this morning. When the pandemic newly started, there was nothing, we had no knowledge about the virus. So there was a lot of headless chicken dance, let me put it that way. But with time, we have more data on the virus, more understanding on the virus, and it has become easier to manage. I mean, by the time data started coming from post-mortem studies in Italy and in the US, it changed the way that patients were being managed because the post-mortem findings could tell us what was really happening. And there have been a lot of studies, even at community transmission, how long do you need to be exposed to someone to be able to pick the infection? And that has really changed the dynamics. But despite having changed the dynamics, there's still a number of unknowns about the virus and why we should still treat it very seriously and adhere to the infection control measures that have been put in place. Having said that, the virus, with new data, management is better of the patient, so most patients are more likely to survive now. However, like my colleague from Abuja said, you should also know that, from Ibadan said, there are people with underlying diseases that make them worse cases for this viral infection. So it is important that we educate people. We let them know that yes, our death rates are low. We are glad about that. However, we have a high population of people that are at risk of fatal outcome of this virus, and those people need to be educated. I was so happy the other day, I put on my television, and I saw a market woman doing the advert for COVID-19, and I said, yes, because I have advocated for a long time that the message should not be, I must commend the governor of Plateau State, His Excellency. We should make him the ambassador of COVID-19. I was blown away by how he spoke. Thank you very much, sir. But we need people like you in the marketplaces also, the market women, in the motor park. You can imagine if we had people talking like him so passionately about it. They will be able to communicate to their colleague. I saw that market woman on television telling us how she wash her hands, how people want to touch her fish. She said, don't touch the fish like this.
Okay, Dr. Rita, we've lost your signal. We'll get back to you when it improves. We'll now come back to His Excellency, the Plateau State Governor. We're talking about resumption of schools. Students will be going back to school to write their exams. And so many states are rushing to, put precautionary measures to ensure that our youths and teenagers don't get infected with COVID-19. What is being done in Plateau State to ensure that?
Well, what is done in Plateau State is also what is done at the nation. I told you that fortunately, I will say that I'm a member of by collaboration, member of the PTF. The 5 governors that sit down with PTF on a weekly basis to determine what will be the next action to be taken in respect to COVID-19 and its protocol. You recall last time we had a communication problem with Ministry of Education because at that time out of consultations from our various states, we came back and we proffered a solution. We said, yes, you must look at the pros and the cons. If you keep children at home, we don't know when this virus will go. And at the same time, you are saying that we should not allow our children to go back to school when resumption, and then some of them are supposed to be going to universities or to other institutions. We have to create an exit for others to move in. And we're taking all this into consideration. We recommended that, yes, schools must resume. But unfortunately, from the ministry was a different approach. But we came back and we understood ourselves very well, and then we made that recommendation. For Plateau, we had done that for a long time. We were prepared. We were always proactive in Plateau. Even on the issue of taking the herbal remedy, you recall that I constituted a committee of experts. I picked out from tertiary institutions. I said, look, we must also begin to look forward to a situation where we will not always rely on conventional or the modern approach to the remedy as a remedy for this. Let us look at our traditional method. And we had experts who came up. As it is now, Plateau is one of the states that had made recommendation to NAFDAC. We are waiting for confirmation. If we get that confirmation, you will see what they have produced. When they brought Madagascar, my people did research and said, oh, the best, what they were using there, the best is even produced in Plateau. Yes. The herbs are produced in Plateau. And they've done the research now, they forwarded it to NAFDAC. And they made even teas and all things that will help. So if you have this, you definitely need your children to resume, because education is also very important. Because I was worried in my state, so immediately we had done fumigation, and we were also prepared, and we said, look, anytime they are ready, we are going to do fumigation again. We fumigate all the schools. We bought, we had consultations with stakeholders in the education industry, and they made the recommendation. What we do is that we leave them to own the process. Just like we do for security, we leave the people to own the process, because we have daily, weekly meetings with stakeholders. I'm the chairman of COVID-19 in my state. I am the chairman, because that tells you how serious we are about it. I the chairman, and in my absence, I delegate the secretary to the government. All of us are very busy. He's the one taking my place. And then in terms of palliatives, I made the deputy governor the chairman. So if no, you can't say even during COVID, we were sleeping. All of us were very busy. So this recommendation about school reopening came from Plateau. Part of it came from Plateau. So now our students have resumed. So we've done all the tests. We asked them, by the time they get there, there is confirmation of tests. And then we put in also some medical facilities within the schools. And to get attention on weekly basis, what will happen, we have a network system. We get information as to what happens in every school, in every week, so that we move our attention. We don't want parents to say, we force their children to go to school. See, their children are not dying in school. We've not had any case. The children were also very happy when they resume. So we are doing that to monitor the effect of the resumption, and that will also help us to make further recommendations about total resumption. That happened to the churches too. You know, the markets and churches, it wasn't easy. The biggest one was even Plateau. When I said I locked them down before we had index case in Plateau. Yes. It wasn't easy. But at the end of the day, they are now pressing me. They say, we knew what you did. So we have to be very productive, as we are saying, not only the leaders, but let us find a way of carrying the community, not only carrying them, let them own it. Let the communities own it. Let them believe that this thing is with us. And we can also be the ones who bring solutions to it. So
thank you, Excellency. You've spoken well with respect to the issue of schools resumption. Yes. But we're not praying to have experienced what other nations did with respect to opening of schools, because some countries have gone back again to lockdown after trying to experiment, opening of schools. So we're not praying for that here. Yeah. We're hoping that the school authorities and government will be able to manage the situation properly, provide all the necessary facilities, and other tools required to manage what we're doing at the moment in terms of reopening of schools. We've not gotten to the reopening of schools. I mean, we were talking about exiting students who are now in schools in Nigeria. Yes. Now, let's return to Oyo State, where we have Dr. Bashir Bello, the Commissioner for Health. Let us know also what is happening in Oyo. Oyo is one of the states that announced the reopening of schools earlier than many other states. So what has the state been able to do to ensure that Naira students are back to school, that all protocols concerning COVID-19 will be observed, and that we're not going to have a rebound, of COVID-19 infection in that state? Let us just know what the arrangements are like, your state with respect to the reopening of schools, which you started earlier than many schools in many states in Nigeria.
For that question. As I've said earlier, the COVID-19 task force that is based on 3 major pillars, that is the technical and the scientific findings, then the data, that is evidence-based data on ground and logic. This was what made His Excellency the Executive Governor, who is also the chairman of the COVID-19 task force, to come to a conclusion, because our passion, at the risk of being immodest, education is our major industry in the state. And education, they say, is the ability to meet life situation. So we employed this ability to be able to meet whatever situation is on ground. Let it be pandemic, let it be cosmodemic, or whatever. But what happened in this case was that His Excellency looked at the plight of our students who are moving from one stage of their educational career to another. That is the primary 6 students who are probably going into the GSS 1 class, and the GSS 3 who are moving to SS 1, as well as the SS 3 students that are moving to, they call it school certificate class or the school certificate examination. We now consider that the population of these students will be almost 1/10 of the entire school. Therefore, there will be enough spacing. So what we did was, with the assistance of the EOC, that is the Emergency Operations Center, conducted some training for all schools authorities, both private and public alike, on ways that the teachers and everybody would adopt. That is the precautionary measures, the preventive measures, as it is stated, that is provision of hand washing facilities, face masks, and whatever. After this training, we allowed the teachers to resume first, about a week ahead of the students. So, and the Ministry of Education is up to the task, always monitoring. We have the LIEs, the ZIEs, and all the monitoring cadres, inspecting the level of compliance, and readiness of each school before they started off. Because we know that, we're talking of a disease, His Excellency, in his wisdom, talking with the technical team at the COVID-19 task force, had come to realize that this disease is going to live with us. Not something we can just get over within a week, a month, or even a year. Let's look at the case of the influenza that came in 1918 and ravaged the whole world. We are still living with influenza till today. But somehow it has been, let us say, arrested to some degree. So that is what we are thinking of this pandemic too. That is this COVID-19 pandemic. So Oyo State had taken the bold step ahead to see. In fact, we were prepared to go ahead with the school certificate along with the other West African nations if they are ready. And if not, at the risk of being immodest again, a state examination board will be formed. That will be at that standard too. Because those who had taught them to that standard to be able to do the examination can as well examine them to consider them, school cert qualified. So those had been the things on ground, that should in case. But thanks to God, the PTF saw the need to take a different step. And you see, we call it a pace setter state. We are not being modest. So we had to, with the involvement of the technical group, because fortunately, that cannot be denied, being the first center of Western medical education, the first center of Western, tertiary education. So we have the brains, which we assembled to get the work done. That is briefly what has been done in Oyo State till moment. Thank you very much.
Dr. Bashir Ballo, thank you. We now join Dr. Rita Oladile in Lagos. As a microbiologist, where we've been hearing of vaccines being, produced in some countries. The latest one is Russia, and the Plateau State governor talked about what they are doing in Plateau State to, bring out a sort of vaccine or something for the people living there. What, as a microbiologist, do you think there's any possibility that before the end of the year we might get something like that in Nigeria, a vaccine sort of for COVID-19 patients?
Well, thank you. So production of a vaccine is not such a straightforward act, because you must have clinical trials. You only try that in animals and then in humans, and you need to document likely side effects, adverse effects. Before the outbreak of this COVID-19, vaccines were things that took years to develop, because you don't want to, you want to be able to document any possible adverse effects, short-term, long-term. However, with the advent of COVID-19 and the rush to get a vaccine out, a lot of trials have been ongoing, and so far there have not been any reports of adverse effect, although we do not have published data out there, clearly published data out there to document that, because the periods have been short. So to say we'll get a vaccine before the end of this year, I don't think that is likely. More like next year. I don't know about the vaccine development in Jos, and I don't know if they've started clinical trials. Clinical trials are not a one-stage thing. You have clinical trials going through a first stage, a second stage, a third stage, and then even the data from the trial have to be peer-reviewed and not to be able to say, yes, we are comfortable, this is safe. So I believe we're a long way off. We are not likely to start receiving the vaccine before the end of this year.
Dr. Mohammed Kawu spoke about, people not really believing because they don't really see the patients in the hospital. Don't you think if that is done in Nigeria, stigmatization might come into play here?
So I do agree with you, but even having said that, don't forget that we also have embraced social media so well. So it depends on how the message is communicated. And then you don't necessarily have to, you have to have the patient's consent. That's another thing. Their consent to be able to be videoed and all. You cannot just do that in a hospital without getting patient consent. That is unethical. And like I said, we could also have people, we can start off destigmatization in quotes of it by people coming up, being able to get people to come out to say, I mean, we have the same thing with HIV infection, okay, plenty of stigmatization. But when you go to places like South Africa, I was amazed. I went to a conference in Amsterdam, the HIV conference, and I saw people wearing T-shirts. I'm HIV positive, I'm proud. I was like, really? I need this in Nigeria. So we can do the same thing for the COVID-19. I mean, it's not a death sentence, come on. And we can destigmatize it, get people to come out and share. I know we've gotten a number of people to come out and share their testimony, their experiences, but we can get people out there in the community to share it and come up with some media storm to destigmatize it. And that way people will be more comfortable to talk about their experiences. And maybe they won't agree that we should show some hospital pictures. But you cannot video people in the hospital without their consent. It's unethical.
Thank you. You know, coronavirus is one virus too many because it has actually rattled the world from all indications, because from medication to even understanding the biological behavior of the virus, it has become so difficult. Over 100 pharmaceutical companies across the globe are working on vaccine. When Russia came up last week to say it has discovered a vaccine, it's still very much questionable across the globe, because of course nobody understands how they quickly came up with a vaccine. But of course they said they have passed through phase 1, phase 2 of the test, remaining phase 3, which of course they need to administer that to over 1,000 people for the world to begin to believe in that. Well, that's just by the way. Dr. Kawu, in Abuja here, we have this information that most of the isolation centers are now saturated. There are no bed spaces any longer for people who may have been newly infected by COVID-19. In that circumstance, is there any plan to start home treatment? Because of course, from what even the governor told us, there are cases where people have been isolated in their own homes, and treatment taken to them there as a way of ensuring that all the patients get treated even without being at the isolation centers.
No, thank you, Gary. Let me correct you. I'm surprised you are living in Abuja. You are saying Abuja in FCT.
In FCT.
FCT means estate.
Yes.
Abuja is the capital. So in FCT, the information is not correct. I can tell you we have excess bed availability. The data that is being provided by NCDC included people that have been discharged, and some people that tested positive in the communities much earlier refused to be evacuated to the treatment centers. So that information is recorded as if they are still positive and they are on admission. How are you getting me? Presently in Idu, that has over 400 bed space, 406 that can be expanded to 500. We have about 100 on admission. So we have excess of about 300. This day dorm that has over 300 bed capacity, we have in excess of 200. There are less than 100 there. Even at Sokoroda, we have 60. As at last time, the number of patients on admission were less than 20. But as it is, I agree with everybody that we may not be able to take everybody that's infected to the treatment center.
Because the report this morning on newspaper, we got a report this morning on newspaper about the FCT situation with respect to bed spaces at the isolation centers.
I'm telling you what is on ground.
Okay.
I don't know why the newspaper got this information, but I can tell you we have, as at now, we have excess bed capacity. But it's because we have not been able to carry everybody whose result is positive to the treatment center. Because of some other things. And that we have started home management for the past 3 weeks in FCT. Okay. I have a family friend that they were living in their house, 9 of them are positive. They are presently treated at their home. We have set up teams that interact with them, in some instances visit them, give them medications free of charge, and tell them what to do. Give them thermometers to be monitoring their temperatures. Are you getting me? So a lot are being treated at home. And I think this is the best way to go. The asymptomatic and mild symptoms can comfortably be treated at home. The government does not have the resources to move every infected patient to the treatment center. You feed them free, you provide toiletries, you provide water, you provide drugs. It's not possible. So NCDC has turned up the home-based treatment protocol. We have sat down in FCT and we have adapted it, and we are using it. So that is what is happening, and I think that's the way to go, really.
Okay.
Yes.
All right, Excellency, the Governor of Plateau State. Let me ask you this. From all indications, it would appear that COVID-19 is not leaving soon. If you look at the statistics globally, people being infected on a daily basis, even in the developed world, you discover that it is on the increase on a daily basis, which leaves us with the fact that this pandemic may last for the next 2, 3, 4 years before it can be finally, annihilated. Right. So now going forward, how, because you are directly involved in the management, of this pandemic in your state and even in the northern part of the country, what do you think we should be doing, in terms of long-term plan that we should be doing? We are talking about students not fully back. Of course, what we have are just existing students. The universities are not in session, and in fact, even religious activities are not in full swing yet. Now, what would we be thinking as a nation going forward? What can we do to ensure that we live with this virus, still ensure that all activities are in place? Is that going to be a kind of protocol whereby we say, look, fine, COVID-19 should be like a normal cough that we have, or normal, a catarrh, that we have. That's also, the treatments or what you take and all of that. Should there be a situation like that going forward? Because we are not seeing an end to COVID-19 pandemic yet, globally speaking.
Thank you very much. And I think I will start from the federal level. You can see that even when it started, there was a move at the federal level. That was why the idea of getting the economic sustainability approach came in. And it's headed by the Vice President. We did very well. Even at the neck and the effect, there was combined effort to improve and find out from and move from to the economic sustainability team. And if you look at the papers, if you look at the recommendation provided by that team, you will know what Nigeria is working on. So it is with the Vice President. I think the Vice President is the chairman. They have done very well, both the economic aspect, the health aspect, and also the security aspect. All those ones are moved, preparations for long-term, short-term, and the remedial aspects as we are moving now. So in that respect, I will tell you at the federal level it's already done. And then secondly, we also adopted it in the states because we are also part, as governors, we are also part of the economic sustainability team because we have our members represented at at that committee, and every time they feed us back. So at the governors forum, we sit down, we analyze, we make recommendations to them. So and then back to our various states. First, as the governors forum, the Northern Governors Forum, we have members. That was what informed us to also set up an economic sustainability team. And that is headed by the governor of Kebbi. They've done a lot and they've made recommendations to us, where is part of the recommendations we are doing. Because we all believe that COVID-19 will not go very soon. But it's also like the doctor from Lagos said, it is not a death sentence. So we shouldn't create fears in the minds of people, always. And that's what we are trying to do. Because once you have fears, people run away. In the beginning, people were running away from it like HIV. They will say, no, there will be stigmatization. They will say, no, this thing, you create fears in me. Farmers were running away from the farm. Even security people were running away. Even doctors. I remember doctors in my state. We realized that people were dying of other ailments than even COVID-19 because there were no attention given to patients in the hospital. So we had to do some kind of sensitization to make people believe that this is not a death sentence. And that was why I said, in the first place, when people were running, I came out openly with my family and I did tests. My family were all negative. And when they were saying, some people said no, they didn't believe it. After a while, I did another test for a whole family, a large family, openly, and they came out and said we were negative. And so the message was carried over. They say, if governor can come out like this and do it, and then why will everybody not do the same thing? So all the commissioners did it, all civil servants now are doing it, and that is the message that is going to the local level. So definitely we must prepare as if this thing is not going to go very soon. But at the same time, we must also put in an opportunity to absorb that with economic activities. Because the moment we stay and talk about COVID always, we will forget about the economic activities. Don't forget As we are flattening the curve for COVID, we must also try to flatten the curve for poverty, flatten the curve for hunger. Otherwise, the two cannot go together. Because they were grumbling. That's why we said there must be ease down. We did the ease down to allow people to do some economic activities. In most of the states, like in my state, that time our revenue dropped down. The revenue dropped down. Now you have to battle with this element, battle with COVID-19, and you need a lot of resources to battle with it. So if the economy is there, poverty, people are now grumbling, definitely you should allow them. And we allow farmers that time. We say, no, it doesn't affect farmers. Farmers started. Now, most of the economic activities, market women, we allow them to go back. And because we are within COVID-19, we brought in and introduced consultancy in our revenue. Surprisingly, when other states are crying that they are within COVID-19, their revenue is not moving. In my state, my revenue has jacked up. Because we take the opportunity, as we are managing COVID, we are also using that opportunity to think out of the box so that we can be raising our revenue, because we believe that this thing will not go very soon. And so if we allow it and to have a dead state, then we will not have capacity to fight the fight the COVID. So just like I mentioned, it is the sustainability team is not only dealing with the economic aspect, they are also dealing with security, the security aspect. All of them will go together. You recall that when people were locked down, so many, the statistics also came out from the security, that so many kind of, the people are beginning to use that opportunity, unfortunately, to develop different kind of crimes. You saw the rate of rape, banditry, you saw kidnapping and everything. While people were being locked down, people will go in, do rape, people will go in, do kidnapping. And so you have to always look at the consequences of some of this. So let the virus not be a hindrance to other activities.
So that is what we're going to talk more about security in Plateau State and the other parts of Nigeria when we come back. But we need to take a break now. We've been discussing COVID-19 and situation in states, and we have a number of tweets that came in. We'll look at them when we return. We take a break now. Don't go away.
All right, welcome back to the program. At this point, we'd like to read out some of the tweets that we received this morning. People are also making contributions, and of course, we have not as many as we used to have, though, because of course we have discussed COVID-19 for a while now. People are getting used to it and understanding what it's all about. First, let's read the Lossy Alpha. It says, though the number of confirmed cases are on the rise, from the look of things, both government and the people are tired of the whole saga and wants to move on, thereby compromising standards.
Actually, it's not a saga, it's a disease that's really existing. And Solomon Kenny Ajay tweets, many people do not see it as a dangerous disease because of the way we are handling the situation. More awareness, especially in the grassroots, is required.
Mutana Farouk says the reported number of daily new cases of COVID-19 is gradually dwindling as a result of the testing capacity. Now, this has precipitated the wrong notion in the minds of many that the coronavirus has been suppressed and gone out of Nigeria. The consciousness is rapidly fading.
And Chris Simon tweets, the new normal as far as COVID-19 pandemic is concerned will go into an archive. It is just a matter of time. So let's adhere to the safety measures and guidelines.
Diligent Solomon says, from statistics, 8 states, including Lagos, Federal Capital Territory, Oyo, Edo, Delta, Kano, Rivers, and Ogun, are majorly responsible for the 70% of the cases recorded in Nigeria. As citizens, we must not be tired in complying with the COVID-19 preventive guidelines. He went on and on and on. I think we've taken what substantial and all of what he said. Go ahead.
And Mike Anyako tweets, real. Though economy is not at its best, but lives matter most. Regulatory agencies should be on top of their duties in this respect, as well as various levels of government, traditional institutions, NGO, faith organizations, and so on and so forth.
From Festus, it says there is no evidence that face masks are effective in school setting. Therefore, students and staff should not be compelled to wear face masks. Festus, I'm not sure that you are right in this one, because globally we're talking about using face masks is quite preventive. So telling us that it should not be used in schools is not a good advice at all. Please, I hope you have to take note of that. Let's go back to our guest in Lagos. Madam, I would like you to speak from a professional point of view. Now, we are talking about remedies, either treatment or vaccine or what have you. You have a better understanding of the characteristics of this virus. Do you think that Nigerian professionals, like those who are, either virologists or those who are really concerned with the development of vaccines or any kind of medication, can really team up together and let us set let us start Nigerian version of discovery of treatment or vaccine from Plateau State? Of course, we had the governor, what he said about what some individuals have been able to do. Is it a possibility for such persons to come together, carry out research into this virus, and see whether we can have homegrown remedy, whether it's treatment or preventive? Is it a possibility? If it is possible, what would you advise government to do in this direction?
Thank you for that. So it is more than a possibility, if I could use that word. We do have a number of researchers that have already started working in that field. And they are having some very good data coming out. We will soon see a number of publications coming out from Nigeria towards that. I do know that there's a lot of work going on that. And I totally agree with you. I wish they could all come together and combine their efforts because, they will have greater input that way. But most importantly, they need government support. If government can fund this research is expensive. If government can fund this research, it will be beautiful for Nigeria to be able to bring out the first vaccine from Africa. But we need funding support. Research is not cheap. And there are we have a lot of excellent minds working within this country. And there are a lot of very, very robust research protocols out there. They are enviable, I'm sure, very enviable. We have a number of renowned researchers within this country working in the field of virology that will be able to develop a vaccine. And I am even sure they have started animal models of it. It's just going forward to go on to clinical trials. But those things cost lots of money, and they need. We should stop looking out to the outside world to fund this research. If our government can support it, it will be beautiful. I'm sure Nigeria will be able to develop a vaccine very easily. We have the capability. We might not have the full infrastructures for it, but we do have the capability. Some excellent researchers within this country.
Okay, thank you so much. Okay, Governor Lalo, you want to contribute?
Yes, I think in respect to that, what even prompted our approach in Plateau was because we made a recommendation to PTF, and PTF also made that recommendation to the federal government, to Mr. President, and Mr. President accepted. He had put in a research fund of about 50 billion. It is with the CBN under TED fund. So that is to encourage our local researchers, and the possibility that if they begin to, because I agree with her, that government will always need to start intervention. It will start from the state, like we did in my state. We started with the state.
What about accessibility? How do researchers access the fund?
No, they have produced the protocol for it. That's why we've applied even to TED fund now. We've applied to CBN to TED fund. We started from Plateau State. We put in a lot of money. I think we put in almost about 10 to 15 million as a start. And so they were all encouraged. They started, and when they produced some of them, they now forwarded it, and they've applied to TED fund. There is, what I'm saying, confirming, I know, as a matter of fact, that there are funds placed by PTF now with the CBN, and is managed by TED fund. And so the process is there. We're telling Nigerians that if you have opportunity to do that, you process it. If you go to CBN or through the PTF, they will tell you how to apply. You make the process and you get the funds. Because we must also try to look out of the box. We'll think out of the box if we have to manage not only COVID-19, but other diseases that will come in.
Okay, thank you so much, Governor Lalo. Let's go back to Dr. Bashir Bello. You've been... Okay, you want to respond to the governor's comment?
So, yes, please. So okay. I'm fully aware about the TED fund, but sir, research is not that cheap. You're talking about clinical trials. AstraZeneca that developed a vaccine from UK, and which is still in testing stage, has spent some millions of pounds in that. The same thing with Pfizer. Now, the TED fund grant says it's a cap at 50 million naira. So I know that we might not have that. We do have those kind of resources just to turn them in the right direction. That's my take. I mean, you work within the government, so you might have a different take. But if TED fund just wants to give 50,000 per research protocol, it's not going to do anything. So maybe they should put together, they should look at these virologists and these different proposals and put them together and say, can this become one protocol with maybe multiple investigators, and then do a robust funding? We're talking about clinical trials, sir. It's not a 50,000 affair. It's not going to do it. It's not going to do it.
Well, thank you. Actually, my question to her initially was how we can bring those researchers together. Right. It's not a question of individuals or certain groups doing on their own. If a nation has a focus on something and say, look, let us get this done, then the professionals come together, and begin to investigate thoroughly, given the time, the finances, and what have you. Right. So let me ask you this question, where we understand that Plateau State is going to host the NAFES 2020, and how prepared is Plateau State, and in the face of COVID-19, how possible is it for you to now host such an event that will bring people together?
Well, the event was supposed to come in, I think, sometimes last March or April. It was scheduled for, we scheduled it for March or April. I agreed last year to host the NAFES, and then COVID-19 came in. So when COVID-19 came in, and with the protocols, I now brought it back to them. I said, you know that it's not possible to host this now within that time. We shifted it. So as I'm talking, I also read on the news yesterday that they had a meeting, and they are still insisting that, well, they want to go to Jos. Well, the last, I must tell you that in the last few months, even when COVID was there, Plateau had been a place for people to visit. I saw a lot of traffic in my state. So some of it is how to even control the traffic within COVID-19.
So for me... Do you intend to host it by November, going by the present situation on COVID-19?
Well, if COVID-19 protocol allows me, it allows me, I'm ready to host them. I'm ready to host them. They know it that I put in every measure on ground. I am ready to host them if the protocols will allow me, if they permit me, because I'm also working under not only Plateau protocol, but the federal protocol. This is NAFES. So if they get the license like they're saying, and they are ready, I am ready to host them in Jos.
All right, I think we are really winding down this edition of the program.
Yes, we'll go to Dr. Bashir Bello to get his final thoughts in Ibadan. We've been talking about research, security, going back to school. Ibadan, Oyo State is a hub for research in medicine. So what have you been doing, looking into, looking for a possibility of a vaccine for COVID-19 from Ibadan Axis?
Very much. You see, that subject actually adjourned the directive of His Excellency, the Executive Governor for your state, Engineer Seyi Makinde, because he has called on the available expert arms, to be able to look inwards. As we have said earlier, Nigeria has the brains. Nigeria has all what it takes, just as our microbiologist from Lagos has emphasized. All we need is just some inter-institutional collaboration. That is interdisciplinary collaboration. When we're able to assemble all this, because from the virology lab here at the University College Hospital, actually belongs to the College of Medicine, we have people who had helped in several, not only in Nigeria, and curbing pandemics in several other countries in Africa and some parts of the world. Professor Wale Tomori is here. He has been in the forehead to be able to make Nigeria polio-free. And he was a former director of the WHO Regional Center in Africa. When we call on these people, the PTF will just make the best use of them. And then, as my colleague in Lagos has mentioned too, all you need to know is that they'll be given the plenty of funds and then housed in their laboratories with little or no interference politically, and tell them to get the best out for this country. And you can be sure that with all the needs, all the clinical trials, the clinical testings, IMRAT is there. We have the people, the ethical committee that also approve of anything. Oyo State Ministry of Health, that is the Department of Planning, Research and Statistics, also has an ethical committee on grant to approve of this. That is coming from other institutions that might not be tertiary based. You see, we have the means. We can always get out of it, and we can always get a solution to it, provided.
Dr. Bashir Bello, thank you. We have to pause you there. Thank you very much indeed there. Back to Abuja here. Dr. Mohammed Kawu, are there any challenges that you face at the FCT here with respect to the curbing of the pandemic? Are you having any challenges of any sort?
Yeah, the challenge is resource challenge. It's a big challenge. Excellency knows. The economic indices, IGR is dwindling. You have to do a lot. And it's not only health. So health is taking a lot of the chunk of the resources that's supposed to come. I told you, we have so many centers and we have to admit patients, feed them free, give them free drugs, give IPC, pay health workers. So resource challenge is really a challenge. I'm getting to a level that I'm realizing that you don't envy the excellencies because you have small resources and you have to balance. Yeah. And this is a big challenge, I must say.
Okay.
Thank you.
Okay, Governor Lalo, your closing thoughts before we go.
Well, thank you very much. And let me also use the opportunity to thank the COVID group for their palliative, and also to thank them, especially the intervention by the Dangote group, because they have set out some facilities everywhere in most of the states. And the World Bank, because this 1 billion they are sending to each state, most of the states, is going to go a long way in setting up some facilities that will health facilities that will help us in the future. And finally, to also say that yes, to tell Nigerians that COVID-19 is not a death sentence, but I think we should find ways of also understanding that we must live with it, but also apply and also work with the protocols as established by PTF so that safety can be guaranteed. So thank you very much.
Okay, thank you so much, Executive Governor of Plateau State, Simon Bako-Lalong. It's been a pleasure having your insight on the program this morning. And we also like to thank Dr. Mohammed Kawu, Acting Secretary, FCT Health and Human Services Secretariat. Thank you so much for coming on Good Morning Nigeria. Dr. Bashir Bello, Oyo State Commissioner for Health, we thank you so much for your input. And Dr. Rita Oladele, clinical microbiologist consultant, Lagos University Teaching Hospital and senior lecturer, University of Lagos. We appreciate your insight into our discussion this morning. Thank you so much. Sports Update is next.